today's life is not gonna be very easy peasy. It is gonna be mind bursting, and it will give you so much insight for all of those, including me, being in the UK, to go through and navigate through the international physiotherapy system and how you can be best of it. Because today's guest is the best. Navigating through different countries, including India, Canada, and UK itself. Imagine the year of experience he is already having working in the UK, and clinically, non-clinically. He has helped so many of students navigating through this path. Internationally trained physiotherapist, especially, he has helped actually to represent international physiotherapist in the UK. So this life you will be loving it. I am gonna love it for sure, and I will get so much of knowledge and understanding through all of this. Hi sir, hi, how are you?
I'm good. I'm good. I'm really sorry. There was some traffic, so I couldn't come and sit. Yeah, I'm
Uh,
ready now. Thank you.
but I'm like, it's my pleasure. Thank you so much for taking out your time and joining us and helping us to navigate through this process. That's what I was telling to every of my viewers so far, that obviously you are new to this Instagram thingy, but you are expert in physiotherapy, and you are the best one. And I'm so excited for today's live, because I'm the one who will be learning from this live more than anyone. I will say that I want to get my question sorted. So thank you so much for this opportunity and joining us on the live.
Yeah, we'll all be learning actually. So it's learning is a journey. Yeah.
Yeah. Perfect, sir. So we will start now. First question from my side is, I just want to know about your journey, your physiotherapy journey so far. You can start from your India to Canada to UK, and yeah.
Yeah. Thank you. So I graduated in '98 January at the Government College of Physiotherapy in Trichy. So that's in Tamil Nadu. And then I haven't worked in Tamil Nadu, so I went to Bangalore and started my career there. And early on in my career, I went into academic leadership. So 1 year into my this thing, I was running that institution, and I did that for around 5.5 years, and then moved to Gujarat. So I had the opportunity to establish a college in Gujarat, and then I worked there as the principal for 5 years. And then in 2009, I moved to Canada for personal reasons. I got a scholarship to do another research master's. So I did that there, then worked as a physio there for a few years. And then in 2015 is when I moved to the UK. So I joined the NHS in 2016 June, and it's been 9.5 years now. 10 years in the UK, 9.5 years in the NHS. Currently, I work as a senior commissioning manager for rehab and clinical lead therapist at an integrated care board. So people from outside the England or even inside the England, they may not understand what an integrated care board is. So happy to explain at some other point, but it is
Yeah.
mostly commissioning work, clinical work, but not non-patient facing.
Yes, sir. So we will love to know more about this job role. Like, what does it actually include?
Thank you. In very crude terms, the Department of Health and Social Care gives money to NHS England, and then NHS England gives money to the integrated care boards. That's where I work. And then the integrated care boards actually commission all of the services, both acute and community services.
Okay.
So they provide the funding to the acute hospitals, the community trust, and so in its crudest form. So my role is mostly I work in Gloucestershire, so it's about commissioning rehab-related projects and activities. That is my role.
Okay, so from this, one thing comes in my head, because usually we young physios think that okay, physiotherapy is all about clinical and treating patients and all these things. But so far, whatever you have mentioned, it is all combination of so many aspect of it. And just like give us more gist about what a physio can do. Other than just clinical thing, what a physio can do.
Absolutely. So UK is one of the countries where the sky is the limit for physios.
Yeah.
And so I worked in India, I worked in then I'm working here now. Especially in India, that linear clinical structure is always there. So you really can't actually, people have actually done different things and gone on to different pathways, but in general, everybody wants to get into that clinical thing. And even in the UK, early on when you start your career, my suggestion is to actually get into the clinical side of things, and especially to understand what the context is, understand the environment that you work in, understand the different organizations of the system, and then slowly you can actually start building what you call as a portfolio career. So you slowly start doing other things like service improvement, and then there are many roles. And I mean, the physios who are actually ward matrons as well. So they call it as a modern matron. So a matron does not have to be a nurse. So it can be a physio as well. So there are many physios who are matrons as well. So these what we call maybe portfolio careers. So you break your kind of clinical routine and then get into something. You can get into infection control, you can get into safeguarding, you can get into different kinds of leadership positions. That's why I say that in UK for physios, the sky's the limit. But first,
Yeah.
you have to have that basic what do you call knowledge of the system, and you'll have to hit the ground running. So many people ask me, like, can we kind of get those jobs from India? The simple answer is no, because normally you come only as a clinician, you do that
Yeah.
work, or
Yeah.
as a lecturer or something, and do that work, and then once you understand the system, based on that experience, you can carry those transferable experiences and start applying for those kind of roles.
Perfect. Thank you so much for telling in detail about it. And I wish to know more about the CSP side of it. How does that work?
One of the council members
Okay,
of
yeah.
one of the council members, there are 12 council members who govern the profession in the UK.
Okay.
So it's called as council. It's actually the board. So I'm
Okay.
one of the elected council members. So they
Okay.
provide strategic leadership for the profession of physiotherapy in the UK. When I say
Okay.
UK, it's England, Scotland, Northern
Great.
Ireland, and Wales, all the countries. Yeah.
Okay, and so because obviously when we are practicing as a physiotherapist in the UK, we need to get to the CSP because that's what my employer said that you need to have your CSP. Will you tell me more about the importance of it? Why is the CSP so important for a physiotherapist in the UK?
Yes, I love the CSP. That's why I volunteer so much with the CSP. Now, when you practice in the UK, you need to have something called as the professional liability insurance and the public liability insurance as well. Now, the
Mhm.
CSP is both a union as well as a professional organization. And there are significant benefits of being a member of the CSP. Now, because I'm a council member, I'm biased towards the CSP, but there are different unions. So physios can take membership in other unions as well. But one of the things that I want to reiterate is that this union culture, it's not there in other countries. So when internationally trained physios, they come to the UK, and when they are asked to join a union, they think that it is an optional extra, but
Yeah.
unfortunately it's not. So if you want to safeguard your practice, if you want to safeguard yourself, I strongly and highly recommend physios to join a union once they start practicing. That is a definite. Now, whether you join the CSP or whether you join another union, it's up to you. But if you do join the CSP, as I told you, it is both a professional organization and a union as well. So when I say professional organization, there's the mentorship platform. There's so much of activities that happen from the professional side of things. So foundation. And if you're outside the country, you can still become a member of the CSP. With what the CSP introduced a couple of years back is the international affiliate membership, and it is 18 pounds per year, which comes to around 2,000 rupees per year or something. But
Okay.
huge value for money, because if you think about you have access to the physiotherapy journal, full text articles. If you think about one full text article, it costs around £40, which is £4,000. Here you
Yeah.
have access to unlimited articles, a lot of articles that CSP members would have written. So I strongly recommend joining CSP as a member.
And along with the part of it where we are like joining as a for the this public liability insurance, is there any way that we can do volunteering as well as a physiotherapist being in the UK? Is there any way we can part being the part of it of the CSP as well?
You can, if you're a member of the CSP, you can partake in all of its activities. The CSP always welcomes volunteers. We have the professional committees. We have, you can become a CSP steward. There are multiple opportunities. I'm happy to chat with anybody who wishes to do that. The opportunities are plenty to volunteer. But then again, volunteering is, it's a culture in the UK. It's really important to volunteer. That is where you, in one way you learn, and in another way you give back to society as well. And it's
Yes,
that's why I do a lot of volunteering. And there's also the learning aspect. If you go into a hospital and volunteer in a ward, that is a learning in itself. If you go to a nursing home and volunteer there, that's learning for you. It is learning in a patient care setting. And that learning is so important for you. You'll never be able to unlearn that, what you
for
learn there,
sure.
the communicating with patients. Yeah.
For sure. So with this, obviously right now there was some recruitment freeze and all these things were happening in the NHS. What do you think about like the job scenario and all these things for physiotherapists at the moment in the UK?
Yes. So it's all about demand and supply. So the demand has gone significantly. So I was looking at the sponsorship data recently to prepare for a different presentation. The graph has gone basically down like that. So just after COVID, there were a lot of sponsorships being offered, but that was partly because there was NHS funding to the hospitals to provide those sponsorships. But nowadays it has completely gone down. There are still sponsorships being offered, but it has significantly gone down. And that is why I kind of reiterate, with the remaining sponsored jobs, the competition has become
True.
extremely severe. So
Yeah.
you just can't spend 5-10 minutes and submit an application and then say that nobody's shortlisting me. You have to be the best of the best of the best to actually get a sponsorship. And then another issue that complicates is thousands and thousands of students came to the UK to do their MScs in physiotherapy, and now they are staying behind on the postgraduate visa. So they already in the country. They have some level of UK experience. So so they'll be in front of the line, if you can say that. So for
Yeah.
somebody to be recruited from out of the country, it is extremely difficult, but not impossible. All I'm saying is that it is extremely difficult, and you have to be the best of the best.
Also, if we want to break that thing, because obviously most of the time it is there that if you have UK clinical experience or some UK experience, then it gives you little edge to know, understand the system more and get into the job market as well. Is there any other pathway like shadowing or volunteering which we can do in the NHS trust as well, and how that works?
Absolutely. For people who are in the UK, that is what we have been advising. Many people are actually, many trusts are taking people for shadowing and volunteering, but there are a lot of HR hoops to go through, because you just cannot take somebody in and ask them to, because it's a patient care environment. So even for a 1 day volunteer to go and shadow, you have to go through kind of 3 to 4 weeks of a HR process of there are multiple hoops to go, and different hospitals have different way. So the best thing is to go to the hospital or give them a call and ask them that this is what you want to do, and then what
Hmm.
procedures that yeah. And what we need to understand is managers and therapists are really busy. So getting their day-to-day stuff done. So for them to take out the time to talk to you and to explain the procedures, that itself is a challenge. So most procedures are available online, And what we need to learn is to read and understand as well, take the initiative on ourselves rather than actually expect somebody to actually spoon feed the procedures. So
Yes.
taking that initiative would be the first step. And for people on the postgraduate visa, my recommendation is, while you have to earn to make a living, what I normally say is that, okay, work for 35 to 40 hours a week, but at least allocate 7.5 hours or 10 hours to do some volunteer work. That way, you have got the best of both worlds. You're making money, and at the same time, you're laying those steps to actually get into physiotherapy.
Perfect. Thank you. Thank you so much for answering this so clearly. For sure, it is the like this that you need to actually do your things and nobody's gonna spoon feed you. One thing, because the Indian system and the international system is quite different from the UK system which we are following at the moment. What is the key advice you want to give to internationally trained physiotherapists? They need to, keep in their head to be at the best of their capability in the international scenario.
A very important question, and a hugely important thing that people need to understand. So there are significant differences. So most of what is practiced in the UK is evidence-based practice. I'm not saying that it's not practiced in India, but when there's a significant amount of unlearning that has to happen when you sorry, I mentioned India, it should be internationally trained. Yeah, so there's significant level of unlearning that has to happen when you come to practice in the UK. Now here you just cannot practice whatever you learned in the book or whatever fancy techniques you learned from somewhere or a weekend course or something and then come and practice on the patient. It has to be evidence-based practice, and that is the important transition that has to happen, which internationally trained candidates struggle a little bit, especially during the initial stages. And then after that, it's that spending that initial period of 3 to 6 months of working on and then adapting to the UK system. That would be important. But if you think that whatever you practiced in your home country, you will come and hit the ground and practicing that, that will not happen, and you're likely to get into trouble.
Yeah, for sure. Thank you so much, sir. And also, I want to know, like, if you can talk more about the association which you have for the like Indian physiotherapist who helps around and navigate all these pathways. Please tell us more about that organization as well.
Yes, so it's called as the British Indian AHP Association. So it is it's an affiliate or arm's length body of the British Association of Physicians of Indian Origin, which is a very strong and powerful, influential organization. And what we thought is that similar to that, it will be good for AHPs to have an organization. So that is why a few of us got together, like-minded people, and we launched it in September. So it was launched, it was inaugurated by the by Professor Susan Rastrick, who's the Chief AHP Officer for NHS England. And then another chief guest was actually Dr. Yagnash Shukla, who is the chairperson of National AHP Council in India, I think. Yeah. So it was a really good event. So what we are trying to concentrate on is how to actually empower Indian origin physios and everybody, all other global majority physios, to actually thrive, to initially come to the UK and helping them with those applications and interviews. And then once they hit the ground here, to help them thrive, because you just can't work for the salary. You have to actually enjoy your work and thrive. So that's part of it. So we have done 3 monthly activities now. And we'll be having further monthly activities which you can follow on our social media channels.
Okay, perfect. Thank you so much, sir. That is was so insightful session. The last question is only your key advice for all young internationally trained physiotherapy, which you want to give, so that we can do our best in our profession.
Thank you. So one of the things that I keep reiterating is that you have to clock in those hours. And sadly, what I said, many people they think that it will easily happen. So people that I speak to, um, they say that oh, I did applications, and then I ask them how much time did you spend per application. They say 10 to 15 minutes. My recommendation is if you're newly applying, 5 hours is minimum on each application. 1 minute. 5 hours on each application. As you once you get to know the application process, then around 2 hours or 2.5 hours each application, and then do a lot of readings. Not only people who are from trying from out of the country. Once you come into the country and start working, your journey learning doesn't end. Then new country, you're practicing in a new environment, so you have to constantly keep reading. So many think that the 0.5 hours at work is sufficient. We can come home and relax and things. It is not the case. You have to read, you have to invest in your own time. It's all about investing in yourself. Do those courses and then also read a lot and get together in social media channels, talk to each
Yeah.
other about the cases that you're discussing, and then that's how you consistently keep upgrading yourself.
Thank you. Thank you so much. It was so insightful. And thank you for, like, again, because I know about your circumstances and everything. It is so, like, I'm so grateful for having you on my page. And thank you for taking out your crucial time for us. Thank you so much, sir.
Thank you, no. Thank you for giving me the opportunity.
Oh, my
My
pleasure.
name is very. I think I'm the only person in the world with my full name. So I'm happy to be reached out on social media or in any other way, and I
Yeah.
can help in any way that I
Yes, sure, sir. I will put down the link on
can.
the on my
Thank
stories
you.
as well, and they will be
Thank
able
you
to
for
connect
the
with you.
opportunity.
No worries, sir.
Bye
Thank
bye.
you so much. Bye bye bye.